morning, so I'm back with another educational video, and today we're going to talk about pain and emotional distress. So pain is an extremely complex condition. You get acute pain that's got important function to protect your body if you've fractured an ankle or you've sustained an injury. But the moment that pain becomes chronic, there's no physiological benefit anymore, and then there's a lot of chronic changes that happens within the body and within the nervous system. So a big part of the emotional distress that accompanies pain, and specifically chronic pain, is the fear and very often also the unknown about what is the cause of my pain. A lot of patients with chronic pain don't know why they experience pain and why they experience the symptoms that they are experiencing. So in order to manage that, there are a few important factors that you need to do. We need to make sure that you have a correct and an accurate diagnosis so that you can eliminate that fear component and that uncertainty that goes with chronic pain. We need to make sure that a patient understands the management and the prognosis of the condition. In other words, what can you do, what can we do, and how can we manage this for you as a team. And then we also need to make sure that we institute the correct treatment for you as soon as possible. And that might be a combination between lifestyle changes, between activities and starting a walking program, between doing pain procedures, between using medication. But we need to do that as soon as possible so that we know that we are actively managing the chronic pain. So what do you need to know? You need to know and understand your pain. You need to know and understand the cause of your pain and what your diagnosis is. You need to make sure that you ask the right questions, and that once you leave the consulting room, that you are happy and that you are settled with the answers that were provided. You need to understand what the maintenance is of your condition. You need to understand the importance of activity and set realistic goals and realistic expectations. Being active and looking after yourself doesn't necessarily mean you need to run an hour a day. It can be as simple as walking 5 minutes and coming back for the next 5 minutes and doing a 10-minute walk a day. So you need to be realistic with the treatment expectations, and you need to follow the treatment plan and the treatment goals that the doctor and the therapist have set for you. And one of the most important things is looking after yourself. So making sure you eat the right food, making sure you look at the food that you take in and food that's nourishing your body and that's nourishing your joints. And you need to make sure that you get enough and that you get adequate sleep. When you are in a deep sleep, there's secretion of serotonin, and serotonin is a natural painkiller. So a lot of patients with chronic pain sleep poorly, and that naturally means that your serotonin levels are lower, and that means your natural ability to fight pain is also impaired. So getting adequate sleep and having a good nighttime routine with good sleep hygiene is of paramount importance to manage your pain. And then there are support groups that you can join. There are leaflets and programs on the internet that you can follow. Be careful for reading too much, because very often information can be scary and overwhelming. But joining a support group can be really beneficial for you to reduce that anxiety and to reduce that uncertainty that very often goes with chronic pain.